Perfect. Well, hello, guys. Please meet the epic, the one and only, the beautiful. She looks great. She's now moved to Canada, but she's flamboyant, shining. Chelsea Dawson. She's going to be talking to us tonight, mostly about acupuncture, but she did say to me, throw me any question you like, love. So
Yep.
if you have got some questions, then do feel free to ask. I'm going to be monitoring the waiting room and letting people come in. I'll be on monitoring the chat as well. So if anybody hasn't got the confidence to put their camera on and put their microphone on, you can put a message in the chat. But Chelsea, please introduce yourself. Tell everybody a bit
Okay.
about yourself, and then we'll start talking about acupuncture.
Cool. Okay. So yeah, I'm Chelsea Dawson. I graduated from the University of Glasgow with what feels like forever ago, uh, in a past life. Very quickly after I graduated, I knew that I wanted to do acupuncture. I was very fortunate that when I was at Glasgow, I was taught by the amazing Sam Lindley. So I kind of already had an idea that I was interested in it. So very quickly after graduating, I did acupuncture training. And then very quickly on the back of that, did certifications in chronic pain. So it was way back when, before there was lots of options for that kind of thing. So I was one of the first cohorts. I think at the time it was VPS doing it, which was the European certifications. Um, there's lots of other certifications and things available now, but at the time, it wasn't really a thing. So it's been about 10 years that I've been running chronic pain clinics, um, maybe just a bit more than that. Initially, I was running it out of a GP practice in England. I then went out on my own, became self-employed, launched my own referral service. I did that for 5 years before my little family decided it was time for me to come back to my roots after being away from Canada in the UK for about 17, 18 years. Um, I moved back. So I'm back in my hometown in Southern Ontario. And I've relaunched True North Veterinary Wellness, which is my referral service. The vast majority of what I do is chronic pain management. Acupuncture is a huge role in that. In the last, I guess it's been 6, 7 years now, I've been teaching acupuncture through the Western Veterinary Acupuncture Group, or Longview CPD. But I also do some other things as well. I've been on cam a few times talking about, our complementary therapies. I do some herbal medicine, things like that. But pain is my thing, the majority of what I do, and acupuncture is a huge part of that for me.
Perfect. All right. Well, let's dive straight in the deep end.
Okay.
Because we're evidence-based, we want to actually understand how things potentially work. So, could you please explain to the viewers what are the mechanisms behind acupuncture? What makes it scientifically
Yep.
plausible?
Yeah. So I think the first thing to be aware of is I'm coming at this from a Western veterinary perspective. A lot of times when people think about acupuncture, they think about traditional Chinese medicine, um, which we're essentially doing the same thing. There's just a lot of different terminology. So I think because of the traditional approach, some of the different terms and diagnoses, they talk about things like chi and energy and whatnot. There's a lot of different things going on there that don't seem so scientific to us because it's a completely different language. Um, a lot of people think, oh, you either believe in acupuncture or you don't believe in acupuncture, which is not the case. Acupuncture, we know it works. We do have a scientific basis for it. Um, Basically, the Western approach has been, let's look at what the Chinese have done and said works, and let's figure out A, does it work? And B, how does it work?
Mhm.
And there is a lot that the Chinese have got right. I mean, their powers of observation are phenomenal. They've been doing it for thousands of years. It doesn't mean they got everything right. And there are some things that have been found out that either don't work or are potentially dangerous. Um, but they did get a lot right. So, like I said, Western approach is to look at it and say, okay, they said it works for this. Does it, and why does it? And that's for lots of different things. But pain in particular is the area that we have the most research in and the most evidence for. or one of the areas we have the most evidence for. Um, Essentially, our bodies, animals' bodies, all bodies, have our own pain relieving mechanisms. So between our nervous system and our endocrine system, um, our bodies are able to produce a significant amount of pain relief. What acupuncture does is we tap into those processes. So it works on lots of different levels. It works at a local level where I'm inserting the needle. It works at the level of the spinal cord. So we get working on certain segments, and we have effects on the brain. So essentially what I'm doing when I insert a needle is tricking the brain, tricking the body into thinking something painful has happened without causing pain.
Mhm.
And when we do that, it triggers this phenomenal response that our bodies have, this innate response to pain that our bodies have, and we start to release our own natural pain relief. And there's lots of different mechanisms in that. It's all very complicated. So like I said, we've got our local effects. So where the needle goes in, we get increased blood flow, which is not only going to be bringing the good things to that area, it's drawing the brain's attention to the area to start sending things that way. But if our patients are on medications, we're getting increased blood flow to the area that potentially we want more of our anti-inflammatory or whatever it is that we're on. And there's lots of different substances that are released when we insert a needle, because essentially the body thinks tissue damage has happened. We need to start fixing whatever's just happened, even though we
Mhm.
haven't caused any tissue damage. So we get lots of sort of local effects if we're treating things like trigger points, which are basically like knots in the muscle. A lot of people talk about having knots in their shoulders and backs. We can directly target trigger points to relax those. So we have lots of local effects that way. We have an effect, like I said, at the spinal cord. So when we have a pain signal coming from the periphery, so we have a pain signal that's coming from an arthritic knee, and it's constantly putting this input into the spinal cord and up to the brain saying, you're in pain, you're in pain, you're in pain. There's pain here. There's something wrong. There's pain. We have this signal constantly going in because it's chronic, right? It's a chronic condition. It's not going away. This is what a lot of our medications we're trying to do. We're trying to quiet down that signal. When we insert a needle that interacts at the same level in the spinal cord, so that might be inserting a needle near the knee, but it could also be higher up the leg because all of those nerves go into the same spot. The brain and the spinal cord then go, wait a minute, the knee hasn't killed us yet. Something new has happened. We need to quiet down that signal because we don't need to pay attention to it right now. It hasn't killed us. We need to pay attention to this new stimulus that's happened
Mhm.
because they don't know what it is. Our spinal cord and our brain don't know. So the initial pain signal gets quieted down for a period of time while the body tries to figure out what just happened. The signal then gets sent up to the brain. And we get loads of things that happen in the brain with acupuncture, and that's the big thing for acupuncture. We get things like oxytocin release, we get some different hormone changes. The big thing is the release of our own endogenous opiates,
Mhm.
so our endorphins. And our natural endorphins can be up to 60 times more potent than morphine.
Mhm.
It's a pretty strong pain reliever. Now, that's not to say that we're going to get that hit every single time to that degree. There's lots of feedback mechanisms, and we can only do so much with the system, but it's a pretty potent system to tap into. So as we insert the needle, the body's going, okay, potential tissue damage has happened, even though we haven't caused any. We got to start focusing on this. We're going to quiet down what hasn't killed us yet. We're going to draw blood flow and all of our healing factors to that area because we don't know what the damage is yet. And we're going to start releasing all of this pain relief to make us feel better because, again, we don't know how bad it is yet.
Yeah.
So our body does all of that instantly. It does that when we get an injury, but it does that when we think we've had an injury. And that's what acupuncture essentially is doing.
Yeah.
The
And
other, oh,
it kind of makes a lot of sense because I can remember Professor Lorimer Moseley talking about, you know, the fear of just like his twig. Do you remember his twig story?
mhm.
and how the body goes, oh my God, that could be a fatal bite of an insect. So
Yep.
even though it's minute
Mhm.
trauma, the body still will have a, but we don't know what that minute could be.
Right. And our peripheral nervous system, so the nerves that are on the outside, not the brain, not our conscious, we're not actually thinking about it consciously. That has no idea. All it's doing is reacting to an incoming stimulus.
Mm.
And then later our brain sorts it out consciously.
Mm.
But initially, the first instance, so a good example, we're dealing with our slow and fast twitch nerve fibers, pain fibers. And I always give the example of stubbing your toe. So when you stub your toe, there's those like few milliseconds where you don't know how bad it is because you
Hmm.
have no conscious perception of it yet. But
Yeah,
in those few milliseconds, everything that I just described has already happened in your body because your
yeah,
body doesn't know if you just broke your toe or your toe got ripped off by a predator or or you're going to get away with it and it wasn't that bad. So no matter what degree of incoming stimulus it is, the body's still going to do all of those things preemptively.
yeah, yeah, yeah,
So
yeah.
the other nice thing is that we know that acupuncture has an effect, well, has long-lasting effects. So we do upregulate the brain's ability to make these endorphins. So we increase our amount of mRNA, which is the blueprint for it. So that even if something happens and we're not doing acupuncture at the time, if an animal goes off and maybe chases a squirrel or jumps off a wall and injures themselves, our body has now been primed for that. So we're making and releasing more of it on demand because acupuncture has kind of trained the brain to do that. And then the other nice thing that it does is it works on the limbic system. So the limbic system is the part of the brain that attaches emotion to pain. It makes us remember it. It makes us suffer with it. And from an evolutionary perspective, for acute pain, it makes us not do the stupid thing again. It makes us remember that really hurt. I'm not going to do it again. But where we've got chronic pain, that's not really, that's maladaptive. We don't need that. So we know from functional MRI studies that where we have chronic pain, the limbic system is highlighted, it's lit up, it's overactivated. And this is why we have so much crossover between mental health and chronic pain, um, and psychological factors that influence pain. Um, Again, from fMRI studies, we know that using acupuncture quiets down the limbic system. So it
Mm.
makes us care less about our pain.
And
And
that's really,
all it's a huge thing. And when it comes to chronic pain, that's the main thing, right? That's in human medicine, our medical counterparts doing chronic pain, there's a huge push on dealing with the psychological elements of pain because the pain's not going away, the chronic condition's not going away. And I know a lot of our counterparts are saying, with our patients, with humans, we need to teach them to not be afraid of their pain. And that's the bit that we can't do. That's the bit that we can't do cognitive behavioral therapy with our pets.
no,
So we have to rely on dealing with the physiological elements of it a lot more than we do with humans. But acupuncture is a really nice way of being able to tap into that a little bit and quiet down that bit of the brain that's making you suffer with it.
two tangents, just
Mhm,
two. One, just because of it's an interesting topic. So I was listening to a chronic pain specialist from Scotland
mhm,
who's been he's quite high up. He was doing a radio thing. And he was saying, out of the biopsychosocial, because you just harped on the psycho,
mhm,
he feels the most unattended aspect and the most, well, daunting and challenging is the social aspect
mhm,
of pain. And I found that fascinating because he's an NHS chronic pain specialist, and the social aspect of pain is how people cope in society living with pain, and how, if they're not coping in society with their pain, how that has a massive knock-on effect psychologically. So the social aspect. And I think we can translate a lot of that into our dogs and how we manage it as well. And I think considering taking your dog to the park and whether they're enjoying it or not anymore, because actually now it's become a bit scary because actually they're not able to avoid that boisterous dog. They're not able to predict what that youngster does. And actually, don't know if I can cope so well anymore. I don't
mhm.
enjoy this so much anymore. So I'm going to hesitate and I'm going to go slow and I'm not going to enjoy it. So I thought that was just interesting because you tapped on psycho. I wanted to go
Yeah,
on
so we've got the
social.
psychosocial.
Mm.
and physical elements of pain. So biopsychosocial is what a lot of people refer to,
Yeah, so I thought that was really fascinating.
and they all overlap. It's
They
all a
all
vicious
overlap,
cycle.
all a vicious cycle. And then the second point, I've completely forgotten. What else did you say?
It'll
You
come
was,
back to you. The limbic system, making us not care about our pain. No.
oh no, yes, I have got it. So I've got flu, guys. So my brain is really not working very well. Um, when you're talking about how affecting the limbic system, we
Mm,
don't need to do it just with acupuncture needles. We can
no.
also, and this is where Chelsea's happy to step off the acupuncture gangplank, and she is happy to talk about other aspects because there might be people here that are listening going, I'd quite like to do acupuncture, but A, I can't get to one, and B, I can't afford it.
Mhm.
There are still principles of what Chelsea's talking about that can be applied. So working on making sure that the dog has pleasure in their life, less fear, less anxiety. So that walk in the park where there is that boisterous dog and they never really enjoy it and they really do go slowly and their head's low and their ears are back and it's not pleasant, that's not going to help their pain. But going to the park at the section where their ears are forward, the eyes are bright, they're really interested, they've got a good sniffari over there. These things can tap into the limbic system as well, and they can really impact pain. And I know a lot of people go, they're going a bit hippy whippy here, but there is strong science behind this,
Yeah,
isn't there?
absolutely. There's loads of science behind this. And like I said, it's something that's been heavily studied in humans, and is certainly the way things are going with chronic pain practitioners in the human field. But it's that overlap. It's like, it's like a Venn diagram. We've got that overlap of the biological elements of pain, the psychological and the social elements of pain. And the worse one of those is, it has a knock-on effect to the others. So if we can improve our social side of things, so even things as little as the dog that can't get on the couch anymore to snuggle with its owner. And that's what they love doing. Or the dog or cat, for that matter, who's taking themselves off and not interacting with the family after dinner like they used to. That's social time. And
Mm.
if we can put measures in place, just, some steps, making sure they get lifted on and off the couch, or improving, whatever their bedding is in the living room so that they do want to be with the family watching TV at night or whatever it is. Those are all little things that add up to improve the social element, which is going to improve their psychological element, which will have a knock-on effect to the biological element. So it
Exactly.
all fits in together. Now, oftentimes we do rely a lot on the biological side of things. So using things like medications or therapies like acupuncture to get us to that point. If they're taking themselves off because they're in pain, it does, no amount of putting some extra bedding in the living room is necessarily going to help that. But just getting some pain relief on board might get them more social, which will then have improved benefits all around.
Yeah,
So it's getting away from that idea of we just have to treat the one thing, we just treat the inflammation, or we just give the medication and that's that. It needs to be very multimodal, and that's what I do in my consults. My initial assessments are very long, and I talk a lot about a lot of things, but a lot of it is how can I improve their life at home? How can I improve their social quality of life as well as psychological, while we're getting all the other stuff sorted, while we're deciding what medications or what therapies to use. So there's plenty that you can do to help tap into that social and psychological side of things and help to improve the limbic system's response to things.
yeah, yeah, absolutely. And just because people might be going, whoa, this is a bit of a dive. This is feels a very big stretch away from the veterinary practice, the Western veterinary practice that they're experiencing at the moment. Vets just don't have the training in this. It's very niche, but also they don't have the time. And when people go to the vets, if I was doing a first opinion consult and I started talking about the dog in the park and reducing a little bit of the fear and that will have it, the person would be straight out the door. They'd be like, I came for drugs, not advice.
Yep.
So this kind of advice tends to be more secondary because it needs more time. And that's why we do have chronic pain practitioners. But also, I feel quite strongly this kind of advice can be given by other canine professionals because it's quite logical. It's very safe, isn't it? So please take heed of this and
Mhm.
share this information because it is analgesic. It isn't full of risks. The only risk I feel is when people don't observe that pain needs managing more acutely, such in medication or interventions, and they try and explore these methods to the detriment. They don't get in there and use stuff together. But realistically, they don't come with adverse events, does it, by looking at?
No, I think what you said is one, and the other thing that I would just be cautious about is what you were saying about the dog at the park. What is the quality of their walk? What is the quality of that social time? Are they looking pretty miserable while they're there and you're just ticking the box, yep, we took them for a walk?
Yeah,
Because there's a difference between having, a nice time, a nice relaxing time, or they're just doing it for us.
yes,
So I think that would be the only risk or thing that I would say to be aware of is watch how they're responding to things.
yeah.
You know, I'm saying, letting them snuggle with you on the couch. Don't force your dog to snuggle with you if he doesn't want to.
You're going to be here. Yeah, but that applies to everything, doesn't it?
Yeah, yeah,
Even with
exactly.
our clinically trialed and tested medications,
Mhm.
we still need to check whether they're
Yeah,
working or not.
yeah.
But
And I would say as well what you were saying about, we're not trained in all of this and we don't have the time for it. This is the same across the medical profession. This is the same in human medicine. The amount of medication that is thrown at people without actually discussing how are we going to get you up and out of the house? How do we get you out socializing and seeing your friends again or that kind of thing? And there is definitely a shift. And I would say even since I started doing chronic pain, just over 10 years ago, um, there's been a huge amount of change and shift.
mm,
Um, but there needs to be more. And I think it's also very different. I'm finding it very interesting being back in Canada because North America, I think, is even further behind than in the UK on some of this
really.
stuff. Mm, mhm.
Have you met my mate Danny yet?
Danny? No.
Danielle Anderson.
Oh, over in Burlington, at SOAR.
So, yeah.
No, I've been in touch, but we haven't met. I have met with Connie over here.
What do you make me?
Yeah, yeah. I've made a few contacts around here and a few in Guelph as well. Yeah.
Good, good. Well, when you see
Yeah.
Danny, give her a big hug and a kiss from me. Um, so back to acupuncture. Explain why we put multiple needles in then, because this is if you think about it, we all get the understanding that the body goes, shit, damage, don't know what it is yet, turning off all information, concentrating on that. Why would we use multiple? Why
Okay.
would we use in different locations?
So, there's a few reasons for that. One is it's not an exact science. Every patient is built slightly differently. Our nervous systems are built slightly differently. And the way we respond to things is a little bit different for each individual. So some of it is a bit of, I'm going to put some extra needles in here because I don't know if I've hit the right point to get the brain's attention. I hope I am. I'm using all of my, knowledge of anatomy and the acupuncture points and where the pain is. But the part of it is making sure that we actually get the attention in the right spot.
Mm,
Um, Part of it depends on the chronicity or the severity of the pain that we're competing against.
mm,
So where we've got a really, really painful animal, or it's been going on for a really long time, we got to make a lot more noise to get the nervous system's attention to bring it away from what that initial pain was. And on the back of that, the other reason is 99% of the patients that we see don't have just one sore part,
yes.
right? Most of them started out with the sore hip, but then they shifted, and now the other hip's sore. And then they shifted forward, and now the front end's sore. And now they can't figure out where to put their weights, and now their back is sore. And that's usually when they present to us because it's when the back starts to get painful that we start to see the obvious behavioral changes.
Yeah.
Most dogs, anyway, dogs in particular, right? Bit different with some of our other pets, but dogs, one leg hurts and they can just get on with things. Oh, I'll just shift my weight onto another leg and it'll be okay. But once they have nowhere for that weight to go, that's when we start to see the really obvious changes. So by the time I'm examining them, we've got pain from one end to the other.
Yeah.
And that's why we tend to use multiple needles. because we're treating pain on all four corners of the dog,
Yeah.
and along their back. And the back tends to take a lot of it. The back is a really nice place to be placing needles because it's pretty non-threatening. They're nice big muscle groups, and tend to get the brain's attention pretty well. Um, Sometimes we put more in because the animal's too painful in their primary painful area too. So sometimes we have to wind the pain down. I always talk about these, we talk about wind up and central sensitization and that kind of thing with pain, but I always talk about expanded pain pictures as well. So where what I just said, it started as one joint, but now it's two joints, or it's two joints on that leg and one on the other leg, and now it's the back. So we have our primary joint, but then this expanded pain picture, all of the muscles and postural changes and things that have happened. We need to wind that back down so it's just our primary pain again.
Mm, mm,
And sometimes we have to start further away from that primary pain because it's too painful to needle near.
yeah.
And what I said at the beginning, we're trying to trick the body into thinking something painful happened without causing pain. We don't want to make it worse.
And that's why acupuncture needles are tiny.
Yes, very, very small.
Just explain that because a lot of people will be like, hmm.
They're very small. The other thing to know about acupuncture needles is they're very thin. We have different diameters of them, depending on the patient we're treating or how sensitive they are to it or how painful they are. But they're also called atraumatic needles. So when we use hypodermic needles to inject or to draw blood, those are traumatic needles. They do cause some minor tissue damage. So because we're puncturing through things, so we are causing micro damage to cells. These don't. Acupuncture needles are atraumatic, so they're solid. They don't cut. Basically, what they do is they part the cells. They're going to go between nerve fibers, between muscle fibers, whatever it is you're going through. It parts it and it goes back to where it was.
Yeah.
So they're atraumatic needles, unless you're doing something really silly with your needles and being too aggressive with things. But yeah, they're not the same as a hypodermic needle.
You do get different needles though, because I can remember
Mhm.
talking to Danny. She's given me a box actually. She's got, no, we use Sarapin. She uses another one which is a bit more dirty.
Yeah, so the Sarin needles glide
Yeah.
better. They're, although I think in the UK there's an issue with getting them at the moment. I haven't had that issue here. But yeah, so I still use Sarin. I've used a few different ones, and I always come back to the same brand that I
Brilliant.
like. Um, but yeah, some of them, I've used some where you put them in and you can almost feel them like squeaking in, whereas the Sarin ones are nice and smooth. So
She shared a box with me. She went, these are a little bit more gritty. So,
yeah, yeah,
let me just call my dog too.
yeah.
I have a Moroccan street dog,
Mm,
and I actually did some reading recently about Romanian street dogs coming over to the UK, and
mhm,
obviously a lot of the behavioural issues that people are coming. And it just really made me realise that Elsie, even though I found her in the middle of the motorway at like 5 weeks old, innately she's still a guard dog. She's a warner.
mm,
So because being a street dog, a pupster, she would always warn the pack. That's how they communicate. Oh
yeah,
my God, does it drive you mental? I can't tell her off because I know it's innate to her. That's
yeah,
her.
yeah,
She's doing it out of mischievousness.
yeah,
It's like, that's who I am. But
yeah.
anyway,
Yep. 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 It's a bit some of those innate things in certain breeds or how they've been raised. Yeah.
yeah, yeah. So I wanted to tangent a bit off the backstory.
That's okay.
The fact that you said quite often animals will cope quite well with pain until it hits their back, especially their neck. And I think just spend a few minutes here, guys, thinking about it. It really is pretty awful when you get back pain or neck pain. And lower back pain is one of the most debilitating conditions known to human beings. It's the biggest health concern we actually have on the planet with regards to people off of work, massive burdens to healthcare systems, lower back pain. Now, what Chelsea was saying, I want to springboard into another little freebie, another little bit power you, another little bit of look at the things that you can do at home. But when we talk about how they start to get discomfort into their back and into their neck because of postural changes, you can use heat sacks, you can use very gentle massage, you can use some hands-on techniques.
Mhm.
And what I found when I was running my mobile clinic, I quite often taught people to just do simple neck massage or simple back massage, as long as there weren't reasons not to, so that they had something that they could do at home. Is that how you feel as well, Chelsea?
Yeah. So again, that's part of what I talk to owners about. I'm not a physiotherapist, but I have some basic training.
Mm.
So I will give very basic physio exercises. If I think they need more, I get a proper physio on board. But yeah, that sort of thing. So that gentle massage, really gentle stretches, heat packs, definitely. In some cases, I do use cool as well, or ice packs.
Mhm.
But again, coming back to some of those things we talked about before with improving the social side of things, if you're helping them by giving them some steps or a ramp to get on and off the couch or in and out of the car, that's going to help to protect their back.
Mm.
And even early on, I have off on a tangent here, but you were saying about, if you were in GP, how difficult this would be. Well, the past couple of years, while I've been getting up and running, I've been doing GP work and emergency work. And going back to that and trying to have these conversations is really difficult. But one thing I have been able to do, which I don't get to do in my clinics, is catch things early. So talking to the people who have just brought their large breed, giant breed puppy in about training them up now
Mhm.
onto using the ramps and using the steps and all of that, getting them used to sleeping downstairs so that when they're old and can't get upstairs and you can't carry them, it's not distressing for them. Those
Mm.
sorts of things. Um, that's going to also help protect their backs in the
Mm.
long run and their joints for that matter. But if they've already got hip dysplasia, it's going to help prevent them from it worsening any faster than it needs to or will do anyway. And certainly is going to help prevent them from having to take the load and strain in their back.
Mm.
So doing things early as well, I think is really useful. And it's all the things that we would do just to help make their lives easier anyway and more social.
Yeah, yeah, yeah. No, I agree. And it is funny when you bounce between the worlds, isn't it? It's like being in two parallel.
You should. I still do some emergency work. I do a couple of shifts a week at our local emerge clinic, and my discharge notes on a painful patient, the texts are like, Chelsea, come on. Like, because it's high, fast-paced emergency, like it's proper emergency work. And I'm like, make sure you put rugs and mats down so they're not slipping. And I need you to do this. And I need raise their dishes up. And I've got all these notes. They're like, Chelsea, it's not a pain consult. We'll give them your card. It's fine.
Yeah, 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 yeah. No, that's good. That's good. Get
Yeah.
some work out of it.
Yeah.
Okay, so now moving on back to acupuncture, can we see how we keep bouncing back and forth? If somebody did want to explore acupuncture, what kind of expectations would you want them to have in place?
So, acupuncture in most parts of the world is an act of veterinary medicine. So, as I don't know anywhere that acupuncture can be performed by somebody who isn't a vet or a vet nurse who is trained in acupuncture. Vet nurses in the UK anyway can. In North America, techs can't. Um, but in the UK, they can do it as long as they're under the guidance of a vet who's trained in acupuncture.
Mm.
So making sure you've got somebody who's qualified. Somebody who's a human acupuncturist should not be doing acupuncture on an animal. And that's because the anatomy is very different.
Mm.
And if something does go wrong, it is a very safe practice as long as we know what we're doing. But there are things that can go wrong. And sometimes it's something that has nothing to do with the acupuncture. A vet needs to be able to deal with that.
Mhm.
For example, some animals who are epileptic will have a seizure after having had acupuncture. If that happens, you need to be prepared for that. So it needs to be somebody who is qualified. That's the first thing. Um, and it's a physical therapy. So, I think depending on where you are in the world, sometimes you don't have as much option of who you can go to. The UK, there are a lot of people doing acupuncture these days. So you may have some more option of where you go for that. But that's not always the case. But if you do, finding somebody that you are comfortable with, we all practice differently. And physical therapies in particular, you know, I like going to see a physio who is going to deep tissue, beat me up. I want to come away black and blue. That's how I approach physiotherapy for myself. But I have plenty of friends who absolutely don't want that. And that is their nightmare. And it's kind of the same with acupuncture, not so much the black and blue bit, but our approach to things is very different. So I think finding somebody that you feel comfortable with, that your pet feels comfortable with, you like their approach to it. Um, some people, it comes down to finances. So it may be that you are just doing it sort of in general practice and it's a very quick session and it doesn't have to be long to be effective, acupuncture sessions. So um, I have the luxury of doing, oh, look at that face. Oh, two there. I saw that. Um, so yeah, I think I have the luxury of having these much longer consultations. So my acupuncture sessions, moving forward after my initial consultation are usually at least half an hour. That doesn't mean the needles are in that whole time. There are some patients who don't want to sit still for it. They don't want to lay down. They don't want to relax into it. And other patients fall asleep while you're doing it. So if they fall asleep, great, I leave them in. But if they're not, I can get an acupuncture session done in 5 to 10 minutes.
Mm.
So it is doable in general practice. So don't think that you're being shortchanged if you've got a vet who's saying, I'll do it just in a regular consult. You can still absolutely have the benefits of
Is there
acupuncture.
any evidence to support needles being in longer being more effective?
It depends on the situation. Certainly, a lot of the traditional approaches would say that they need to be in longer. But as far as what we know from an evidence-based point of view, the effect that we're having on the nervous system is when we insert the needle.
Mm. Yeah,
Okay, so I can amplify that by stimulating the needle.
yeah,
So that's where we kind of pull it in and out. We call it um, we'll in out needling, or we can just stimulate it and leave it in. Sometimes we use electroacupuncture, which is when we put little electrodes on it to increase the stimulation. So every time that needle moves, I'm potentially getting the nervous system's attention.
yeah,
But if I have a pet that I stick the needles in, they fall asleep and I don't touch them again for 15 minutes and the pet's asleep and doesn't move, I'm not getting any additional effect than when I first put the needle in.
yeah, yeah,
So it depends on what you're trying to do. Now I have this bulldog that I treat right now and he absolutely like he doesn't care about the needling. He just does not want to sit still.
yeah,
He absolutely does not. And I don't know any of you try if you've got bulldogs or have ever tried to hold a bulldog still, but
yeah,
it's not easily done. It's like trying to hold a hippo still. So with him, the owner holds him and I do what I call in-out needling. So I put my needle in at the point that I want to treat, do this a little bit. I do quite a bit of simulation. I take the needle out, we let him wander around the room. He comes back, I
yeah,
do the next one, and I do it that way. So his treatments are very, very quick, but effective.
yeah.
He's still getting the treatment. We're still seeing the effects of it. He's just not one that's going to lay down and relax into it.
No,
So it doesn't have to be an event. I think a lot of people think that acupuncture needs to be a whole thing where we go and it's very chill and it's not your typical sort of consultation. It doesn't have to be. We can absolutely have effect.
to be
And when I was
fair,
in general practice, and even at the Emerge clinic, I use acupuncture for a few different things, and I just do it really quickly.
yeah.
Yeah,
To be fair, the event concept would be much more supportive of the placebo effect, wouldn't it? Because you're creating so many more, well, you're creating another big variable that's going to influence it,
absolutely,
it.
absolutely. And we do know that with acupuncture, we can capitalize on the placebo effect. No different than any other physical therapy, right? Because the pet makes associations with it. So years ago, I had a dog that I used to treat, um, who made the association of how she was feeling because of the acupuncture. She was one that got really relaxed and very chill in an acupuncture session. She made the association not with the needles, but with my voice. So if she was waiting in the waiting room and I didn't call her in straight away, she could hear me talking to somebody else. She would start getting relaxed in the waiting room
Yeah, yeah, yeah. That's nice.
because she made these, so her brain had already made it's Pavlov's dogs, right?
Yeah,
It's that association that they make. Now, I can't just use my voice long term. That's only going to work for so long unless I'm still topping up the effects with the
Yeah.
acupuncture, right? But we do have a bit of that and we can capitalize on it. So having a bit of a routine around it, yes, we can enhance the effects potentially,
Yeah.
but that's on the periphery of it all. We can
Yeah.
still have the main effects, even if we have only a few minutes to do it.
Okay. So then, if somebody was wanting to give it a go, how many sessions would you suggest that they should buy into before?
So I usually tell people to commit to at least 4 in relatively quick succession.
Okay.
So that might be twice a week for 2 weeks. It might be once a week for 4 weeks. That's usually what I do, once a week for 4 weeks. There's a few different reasons for that. Um, the main reason is because what I said before, we're upregulating the brain's ability to make and release endorphins. And if we do a few in quick succession, we're going to get to that point a lot quicker than if we're only doing it once a month or once every couple months. We're never going to actually train the brain to make and release those endorphins outside of acupuncture treatments.
Yeah.
So that's part of it. The other reason that we do that, particularly with animals, is in humans, we can say, this might hurt, sit still, you'll feel better after. We
Yeah.
can't do that with our patients. So I mentioned trigger points before. So these knots that we get in our backs and our necks and all of that, animals get them the same that we do. They're pretty sensitive, especially if they're particularly active trigger points. In a human, oftentimes physios will go, I'm going to treat your trigger points, and it hurts. It's not pleasant. If I did that on a first session with one of my patients, they'd never trust me again.
Yeah.
So we have to build up to it. We have to build up to the more painful stuff sometimes. Oftentimes I don't end up treating the trigger points because by the time I've wound the rest of the pain down, they just relax and I don't need to worry about the trigger points. But um, we can't rush into it the way we do with humans because we can't talk them through it and explain what we're doing. So then they become fearful of us. So we do have to take it a little bit more slowly with our patients.
Yeah.
Um, but the main reason that we do it is because of this upregulation of the mRNA in the brain.
Perfect. So I know what I think people should do prior to doing any therapy,
Mhm.
because there's the social side of, the expectation, the exchange of money, the time, the emotion spent. And I'm going to say what I think people should do is be really aware of what your dog's clinical signs of pain are so that you can be the best person to monitor whether that intervention, no matter what it is actually working. And then you can choose the therapy to suit. Is there anything else you think that people should really have strongly in place prior to kind of investigating acupuncture?
Well, I think I think having a grasp on what the plan is and what it is that we're trying to achieve with it is a good idea.
Mhm.
I think I am like the biggest advocate for acupuncture, but I certainly don't put all my eggs in one basket with it.
Mhm.
So I think that it's worth having a bit of a plan around what we're going to do, how we're going to treat this pain. Do we need to have any other treatments on board? Um, like I just said, it can take a good few weeks for things to really kick in with acupuncture. Some animals, first session, it's like, oh my God, they're great responders. After week 1, we've had huge effects. Other animals, it takes a good 4 weeks of me treating them to get that cumulative response and that brain's ability to do what we want it to do. And 4 weeks, if we're not actually treating the pain in the meantime, is a long time.
Yeah.
So I think, knowing what your dog's tells are, how they show pain, like you said. And again, that's, I take referrals, and that's one of the things that I do in my first consultation. I go through loads of questions so we can figure that out.
Yeah.
But if you don't have that ability or you're doing this through your GP vet, knowing what it is we're looking for, what your dog's signs are, of pain, to know if it's having an effect or not, but also knowing that we are managing the pain appropriately anyway. You know, acupuncture, there is some evidence to show that it can have some anti-inflammatory effects, but that's very specific type of needling very rigorous needling at very specific points. It's not anti-inflammatory like something like a non-steroidal anti-inflammatory would be. So I know one of the things that you guys talk about is, and I harp on about this a lot, especially with colleagues, is you can't just change one for the other.
Yeah.
So if I've got a dog that I know is in the throes of a really bad arthritic flare, I want something to take away the inflammation.
Yeah.
You know, our primary type of pain and our primary source of pain is inflammatory. We got to get rid of that. That doesn't mean I'm not going to start the acupuncture at the same time, but so it's being aware of those things, I think,
Yeah.
instead of just putting all of your eggs in one basket. I think the other thing that I would say is, and I'm very aware that acupuncture is not accessible to everybody, either because of where you are, whether it's offered, but also time and money. Um, but I do use acupuncture early on in my treatments.
Yeah.
It is not a last-ditch effort treatment or therapy, or shouldn't be. I use it as one of my primary, this is one of the first things I get on board with some of these chronic pain cases, where possible. So I think don't leave it till the last minute and think that's going to be the last thing I try, because I think then you're not going to have the same effects that you could have with it.
Yeah. No, definitely. I think we might as well have that kind of like open conversation. It is very difficult being a chronic pain practitioner, because when you try and manage chronic pain really, really early, when they're really still quite healthy and they're still very, very agile and they're still living the best life, but they've got that, it can be really hard to show the caregiver that what you're doing is having an effect. So it's quite hard to get them on board that it's having impact, isn't it?
It
And
can
then
be, yeah.
you got the other end of the spectrum where they're so ridiculously painful, debilitated, there's no muscle mass left, they've got proprioceptive deficits, everything is just a car boot sale of badness. You can't really impact them. And it's a sad truth about the early stage though, isn't it? I know there's been many clients that really in the early throes and you can see what's going to pan out and you're really trying to get these changes in place and these input. But because they're not showing strong clinical gains within a 1 to 2 weeks of them having that intervention, there's a lack of commitment to it. And I get it because you don't see the value in it. Have you experienced the same?
Oh, absolutely. Absolutely. And I think it yeah, it's hard. Like I have a patient right now who she's a wonderful owner, very dedicated, big like Leonberger type dog,
Uh,
who is 3.5. And I met him when I was doing GP work. He came in for his vaccination, his annual, and happened to mention to the tech that I was working with that a few months ago he ended up at the emergency clinic because he had a sore back.
yeah,
He had jumped out of the car and hurt himself. So he was treated and got better. And that was that. The week prior to his vaccination, he had tried to jump out of the car, but he was still attached to his harness and kind of hung himself by his back. And it flared up again. Owner still had some Medicam at home. So she gave him that. But everything's back to normal now.
yeah,
So she just happened to mention it when the tech said, has there been anything recently? So I went in and examined him. And of course, I can find tension and trigger points down his back. And I was a little bit worried, was it coming from his hips? Thankfully, the owner listened to everything that I said. We did x-rays, spondylosis the whole way down his lumbar spine.
oh,
Yeah, a lot of bridging spondylosis. So she started coming to see me in my pain clinics. This dog is now on omega-3s. I think he's on a joint supplement of some sort, and acupuncture, and that's it at the
amazing.
moment. And we're keeping him going. And when we lapse, so if we go too long between sessions, he gets sore. Now she was sure he was back to normal. After the first 4 weeks of acupuncture, she came in almost in tears saying, I haven't seen him play like this at the park with his friends since he was about a year old.
Nice.
And she just assumed that it was because he was getting older and more mature.
Yeah, yeah,
But really,
yeah.
it was his pain that was stopping him.
Yeah,
So, that was a really nice one because there was an obvious change in him. And
yeah,
now he's just on that. And she's well aware that at some point he's going to have to go back on medication. At some point, the acupuncture is not going to be enough. But if
Yeah.
we can stave that off a little bit longer by using the acupuncture and other things, then great. She also does some physio exercises, and we've done lots of home adjustments and all of that with him.
Yeah.
So I think it's nice when we can see an obvious difference. I think if I'm not seeing an obvious difference in either, I'm not treating them properly, or am I just assuming there's pain when there isn't? Just because I know that I saw an x-ray and the dog has something going on the x-ray, how does that equate? So I think, if I'm sure that a dog has pain, then something I do should cause a change in them that the owner should see.
Okay.
And it
Okay.
might not just be physical changes. So that's one thing with acupuncture. Um, I do a lot of discussion around don't just watch the physical things, don't just watch the lameness. The lameness is probably not going to go away. So I have one with elbow problems, and elbows are, the worst when it comes to the joints, right? In dogs. And the owner is was so hung up on the limping because it's really obvious in the front end, right? That
Yeah.
like head dip they do. Um, and I week after week just kept saying, you've got to stop looking at her lameness. Stop looking at the lameness. I'm hoping that the lameness will improve, but it's never going to go away.
Yeah.
Her elbows are that bad, it's never going away. I want you to focus on the behavioral things. I want you to focus on her happiness
Yeah.
and the things that are important to her. How she's interacting with the family. Is she still excited to go for her walks, even if we can't go as far? Is she enjoying them? That kind of thing. And that's the main thing that acupuncture does. Yes, it can help and improve mobility, but the number one thing that it does is it just makes them happier.
Yeah.
And that's the number one thing that owners come back with going, I can't really put my finger on it, but she's just happier.
To be honest, that's very much like a mantidine, though, isn't it?
Mhm. Well, it's also what our opiates do.
Yeah.
Opiates don't actually get rid of pain. They just make
No.
us not care about it.
Yeah. Yeah. Exactly. Um, I had another question, but my marshmallow brain. I'm going to look. I
I
had a
did, while you're thinking about that, marshmallow brain, I was going to say, you mentioned, we talked about doing the first few sessions every 4 weeks, but I didn't say what happens after that.
yes.
You're
Do
not
that.
stuck doing weekly acupuncture for the rest of the pet's life. At 4 weeks, I reassess. Sometimes I do another few treatments in quick succession, depending on how bad they were and whether or not I'm winding them down further. But generally around 4 weeks, we start to space it out. And then I would go to every 2 weeks, then every 3 weeks, every 4 weeks, and we just monitor the pet for how long the effects last in that individual.
Yeah.
So, and that will vary depending on individuals, but will also vary depending on the degree of pain that we're dealing with.
Yeah.
So most of my chronic patients I see every 4 to 6 weeks long term. Um, some of them, maybe it's every 3 weeks. And then when we're getting into much later stages, when we're kind of heading towards end of life care, some of them I'm seeing weekly or every 2 weeks, but that's pretty extreme. And that's like much further down the line. In the long run, it tends to be every 4 to 6 weeks long term.
Amazing.
Yeah.
And that shows the importance of learning the clinical signs as well, isn't it?
Yeah. Yeah. And that's where I really get owners. I'm like, I need you to really pay attention here
Yeah.
because now we're spacing it out. And especially when we start to get to like 5 or 6 weeks, it can take pain up to 6 weeks to wind up.
Yeah.
And it could equally so take up to 6 weeks to wind it down if we're doing it properly. So as I'm getting to that 6 week mark, that's where I get a bit twitchy and I'm like, you have to pay attention, pay really close attention because it's the subtle things that we need to notice. And oftentimes owners will come back and go, she did okay, but I definitely saw that she was quieter this past week. So I think we'll stick with 4 weeks instead of
Yeah.
5 weeks or whatever. Yeah.
Yeah. No, like that. Um, I think I wanted to kind of harp on, because I know that you're on board and you've already mentioned this, that acupuncture isn't the replacement. Um, and there's something that the Royal College over here make very clear, the distinction between alternative medicine and complementary or integrative, whatever term you prefer.
Yep.
And we're very discouraged from alternative because that tends to suggest using it instead of recognised veterinary practice, Western-based medicine, evidence-based medicine. And acupuncture isn't that, is it? It's to be used in combination with.
Yeah.
Is that right? Are you happy
Yeah.
with that?
Yeah, absolutely. So I have this conversation a lot. So I think we talked about it a few years ago on some chat that we did about this term holistic because a lot of people like to call me a holistic vet because I do things like herbal medicine and I talk about nutrition and things like that. And I don't mind the term holistic by my definition, but it's really polarizing because I think some people think that holistic means all natural,
Hmm.
and some people think holistic means witchcraft.
Yes.
My view on holistic is I'm using every tool in my toolbox that I have available to me and tailoring it to each individual patient. And those tools include some of the other complementary things, as well as my veterinary training in
Yeah.
medicine and surgery and whatever else I'm going to be doing. And I make that clear right from the get-go because I do get lots of owners contacting me thinking that I'm going to be able to take their pet off of meds because I also do things like herbal medicine. And
Yeah.
right from the start, before I even get them in my consult room, I make it clear, most chronic pain patients that come to see me go away with more medication than
Yeah.
they
Yeah.
came in on. And again, that comes back to that biopsychosocial element where we have to rely a lot more heavily on the biological side of things with our patients.
Yeah.
That's not to say we ignore the other bits, but chronic pain in animals, they end up on a lot more therapies and a lot more treatments because we have to control that element much more, because that's the only one we have the ability to have that much control over.
No. And
So
the
yeah, it's not.
psychosocial control is very much with the caregiver, and that's why we need to be giving them more information and
Yes.
more tools, isn't it?
Yep, absolutely. So no, it's not a replacement. I gave the example of one dog that I've got off of medications, but he's a young dog. This is a dog that came to me and we caught it really early. Now, had I not seen him for his vaccine, I might not have seen him until he was much more crippled later on in life.
Mm.
So that's a very different situation. Most of my patients are on all sorts of things, including acupuncture. They'll be on a combination of non-steroidals, gabapentin, amantadine, ketamine injections, all sorts of things. Tylenol or paracetamol. Um, so there's loads of things that I'm doing alongside because they all work in different ways. And our
Yeah.
pain pathways, when we get chronic pain, we have to target it from a lot of different angles.
Yeah. Yeah.
And like I said, acupuncture is not anti-inflammatory the way a non-steroidal is.
No. No, it's a shame that people have a wish to be in one camp or another. Yeah, it's
Yeah, it's difficult. And when I have owners that are really keen to get them off of medication, I never make any guarantees about that ever
yeah.
because most of the time we can't. But what I do try to do is I explain I use all of the things up front. I'm
Yeah.
much more a go all in and then we'll back off from it rather than like every few weeks add something in because
Yeah.
we're not quite there yet. I'd rather go all in and then start slowly backing away. So I tend to go in on meds while I'm doing my acupuncture or starting on herbs or whatever else it is that I'm doing. We go in on the meds so that we know where the bar is.
Yeah.
We know how good they can be, and then if I slightly reduce those medications, once everything else is in effect, can I maintain that bar?
Yeah. I'm glad that you said this because this is something that kind of it's just interesting that we all agree that the meds tend to set the bar, isn't
Mm.
it? This is fascinating because we've got people that want to branch away and have the alternative approach, and it's but often the meds are where people set this kind of bar of impact. Do you see what I'm trying to say?
I would say yes, because they work faster.
Yeah.
They're going to work faster than anything else because we are altering the system,
Yeah.
right? So we're not pushing the body towards more normal. We're not trying, those sorts of things, which is what a lot of the complementary therapies are doing. It's trying to work with the body and make the body more normal than it was. Whereas
Yeah.
our drugs are coming in and actually altering those systems. We're either pushing something harder or faster or slower or whatever it is, or
Yeah.
blocking signals and things like that. So we get an effect much quicker. And that's why, especially when I've got a very painful patient in front of me, I am all for, looking at all of the other things, but nothing is going to make them comfortable quickly unless I get meds on board.
Yeah. Yeah.
And my view on meds, a lot of people are scared of the side effects of them and that kind of thing. And I understand that. But also, again, coming back to our psychological and social element of things, An animal knows when they're in pain. They don't know if their kidney values are a bit high.
No, no.
They're not consciously thinking, my kidneys, but they know when they're in pain. It's the pain that affects the quality of life.
Yes, I agree.
So I agree with trying to balance things. I don't want to put animals on medication or tie them to lifelong medication if I don't have to, like that young dog that I just talked about. But he was one that was on Medicam when we started the
Yeah,
acupuncture.
yeah,
And then we got it on board, and then we gradually reduced it. And we monitored him very closely, and we're still maintaining that bar without
yeah,
it.
yeah. Yeah.
So it's a case of using all of it. It all works in different ways. And I don't think we should be in one camp or the other. I think we should be using everything.
I agree. I really do agree. I think that it is about trying not to kind of get caught up in a bit of a pointless war that you
Mhm.
read and hear about. At the end of the day, it's the dog and what the dog wants. And if we really do believe that they're sentient beings, if we really do believe that they have the capacity to feel and have wishes and wants and needs, then we need to respect the fact that they would want to be out of pain as quickly as possible.
Yeah.
And I think with the science that we have, the understanding that we have, we need to use that to make that possible. God, I sound awful. 1 minute.
Okay. No, I agree. I agree completely. I think like I said, it's every tool in the toolbox. We can't afford to throw any of the tools out. Whether you're coming at it from a complementary, integrative, holistic, whatever word you're going to use, perspective, or you're coming at it from a allopathic, conventional perspective, I don't think we have the ability to throw anything out of the toolbox.
No.
I think there's only so much that we can do. So why throw it all out? I have this conversation about certain medications too, medications that come in and out of favor
Yeah.
amongst colleagues. Just because, a new study came out saying, oh, it might not be as great as we all thought it was. Just because of that headline, I'm not going to chuck it onto my toolbox. If I have patients that I think benefited from it, I'm going to continue them on it.
Yeah.
So that's happened with a few different meds over the years. And
Which one? Are you talking about tramadol?
well, yeah, and I think gabapentin's had a little bit of
Gabapentin
but
might have a renaissance.
it's I
So
just yeah.
Robin Downing's got a study coming out.
Oh, that's good. A good
Yeah.
one. I assume.
I haven't seen it yet.
I just think, so when all this stuff happened with tramadol, I still keep tramadol on my shelf.
Yeah.
It's not something I'm using as a primary pain reliever. It's not something that I'm using on its own. It's certainly not, the only post-op pain relief that a patient's going to get. But the studies that came out, the way it was tested, the methodology, there were inherent issues in it because they were comparing the movement force plate analysis of dogs with arthritis who were on Rimadyl
Yeah.
or tramadol.
Yeah.
Well, tramadol is not anti-inflammatory.
No. No.
So, of course, the anti-inflammatory is going to make them move a bit better because you're reducing the inflammation. But one of the studies that came out, if you read the comments at the end, said, incidentally, the owners of the dogs who were given tramadol all reported that the dogs seemed happier. So, I think it's still a tool that we can use. It just needs to be used appropriately. And it's
Yeah.
like that with any of our medications or treatments. Like I said, acupuncture is not a replacement for an anti-inflammatory. They all work in different ways. They all have different benefits. They all target the pain pathways and systems in different ways.
Yeah, I agree. And many, many years ago, I was thinking about the huge amount of variables of any treatment that we use. So not only have you got the evidence behind the medication, then you've got that independent body. So everybody's body is different, how they process medications. They might not be well equipped with a certain cofactor or an enzyme to break that drug down into its active form. Their circulation might not be as strong to circulate it around the body. They might have a huge amount of adipose tissue where it gets trapped. And then you've got all like the interventions. You've got the therapist's natural skill base, the therapist's education, the therapist's mood on that day, their therapist, time that they spent. And the variables of the cat that rang past just as they came into the building and caused that dog to kind of freak out and stress all their joints. And the car
Yep.
journey, the owner braked suddenly and the dog leaned for. There's so many variables, aren't they, that affect whether something's going to respond or not. But the only thing that I think is absolutely so essential to everybody is they learn to read their dog's signs of pain, and have the ability and the empowerment to say that's worked for my dog. And these are the reasons why. I definitely saw benefit here, 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 and here. I'd like to continue with this. Or I don't believe that that's worked for my dog. I haven't seen anything change. I'm going to walk away from that. I'm comfortable to walk away from that and try something else.
Mhm.
That's my gut belief. Is that how you feel?
Yeah, yeah, I absolutely agree. I think we have to make sure what we're doing is useful. From a financial perspective, especially when we're doing something that costs more, like acupuncture.
Yeah,
Um, but also from a side effects perspective, why keep an animal on something with the potential side effects if they're not having a response to it?
yeah,
Um, but I would also say one sort of thing to be aware of with that is this idea of chopping and changing meds quickly.
yeah, oh, yeah,
And okay, so he went on gabapentin. We've been on gabapentin for a week and we've seen no change
yeah,
whatsoever. Okay, well, gabapentin's got a massive dose range,
yeah,
right? So maybe they need more. Maybe they need it in conjunction with something else. So it's tricky. This is why we don't get taught in detail about this in vet school. Like chronic pain is messy. It's emotional.
yeah,
It's not A to B. It's not if we give this, this is what happens. It's really messy. It's really complicated, and it can be really frustrating because it's not just, yep, they did well on that med and now they're fine.
yeah,
Right. So, and this is why it doesn't get taught in vet schools and med schools to the degree that we would like it to.
yeah,
Because it's really complicated and messy, and there is an art to it, I think.
yeah,
Um, and it is that like being able to say, okay, so we've been on that new medication for 2 weeks, we've seen no improvements. Am I going to take them off it? Am I going to give them more time? Because sometimes it can take up to 6 weeks to wind pain down.
yeah,
Or does it need to be in conjunction with something else? Do we need to change the dose of it? So
yeah,
there's all these things, and I see lots of animals come into my clinic where they had the anti-inflammatory for 2 weeks, didn't work. They had gabapentin for 2 weeks, didn't work. They had amantadine for 2 weeks, didn't work. And I'm going, okay, but you stopped that one and then you started another, and they're all doing different things. So one of the things I talk a lot about when I'm doing lectures about recognizing pain and things like that, or how do we choose what to give, is break it back down to the basics. What kind of pain am I treating?
yes,
Is it inflammatory? I'm sorry, you might be able to hear my gremlin barking. Brian's barking in the background now. Um, so yeah, is it inflammatory pain? Is it neurogenic pain? Is it myofascial pain? A lot of these are mixed pain picture, which is why they need more than one thing.
yes, yeah, 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 totally. I totally agree with you. And I think also having time to talk to the client. I did a teleguidance today, an hour and 40.
My initial assessments are 2 hours.
Yeah. Well, the
Yeah.
teleguidance service that we've set up, James Hunt, gorgeous James Hunt, Katie Smithers, Evie and me. Um, we get the history, we get the photos, the videos, we get the questionnaires filled in, we get the CBPI. That in itself takes 2 hours minimum. And then you end up with an hour with them online, and quite often, like today, an hour and 40, and then you've got to write your report afterwards. So that's it's pretty brutal. But it's I just likened it to being like in a little river where you're picking up stones and looking underneath and putting them back, and you're just lifting up all different stones and you're trying to work it out. And quite often you come up with a plan. It might not be the right plan, but it's a process. And the case that I saw today is a case of actually us coming off of medications. So this dog's been on fluoxetine, gabapentin, Previcox, Librela, and there's something else in there as well. And the dog's like, I'm thinking, okay. think we're gonna scale this back now.
Yeah,
So it's quite a lot of hard work, isn't it?
it is. It is. And yeah, sometimes I do the same. I take them off of things. Um, Sometimes I do that a lot with my herbal stuff as well. They tend to come in with a lot of supplements that they're on. And we have to scale that back massively. I'm like, well, why? What are we achieving with all of this? And we got to go back to the drawing board. And I do that with meds as well. But it's complicated and it's frustrating and it's frustrating for
Can I just
owners.
do me a favor? Like I just really appreciated what you just said then, because I see this so much where you look at somebody and it's almost they get to the point where they're filling in diet and supplements on the questionnaire,
Mm.
and there's a pride with the list of what they're buying monthly and plugging into their dog. And I sit there going, no.
Yeah, and I'm saying this as a herbalist. I'm someone who uses herbs for most of my cases in some capacity. Um, but there's so much out there, and there's so much false economy out there when it comes to that sort of thing. And owners come in with shopping bags full of supplements. And it doesn't mean that some of the stuff isn't useful, or doesn't have an evidence base. Um, but it's like we don't need all of this. We scale it down. I just taught a vet course a couple weeks ago, one of our herbal courses, and one of the things that we teach on that is try and scale it down to around five
Mm.
plants, five herbs that we use in our when we're mixing or choosing for an individual, because you'll end up on hundreds if you just, yeah, you don't need it. You don't need all of that. But that's where, people with herbal training can help with that kind of thing. But I find it, it's the same with meds, and it's finding the right combination. I always say we got to figure out the right cocktail that's going to work for them.
Yeah, totally. And I think what we play with is people's emotional wishes to demonstrate how much they love their pet. And when I see people writing their list of interventions, I know it's because of love.
Mhm.
It's the wish to feel that they're doing everything that they can, and then just want not to be judged. They want to be praised. And I'll often get people filling their questionnaires, and it's extensive. And you're like, stop. You don't need to demonstrate your love like this. Let's rethink this.
Yep.
Right, my voice is now going.
Oh, I feel so bad for you.
No, it's fine. It's the phlegm. Oh my God.
We need to mix up some herbs for you.
I do. Can you send them by pigeon post quickly, please? Thank you so much for your time, Chelsea.
No
I'm just
worries.
really aware of the fact that we've been going over for an hour, guy. Before I go, has anybody got any questions? Do pipe up now, like turn off on your microphone, show your face, and say, please, I've got a question. If you haven't, but you do think of one later, then always do, message on the member zone, and we'll get that to Chelsea and she can answer. Thank you. Thank you, Janice. Um, but hopefully you've enjoyed this evening. Cam is very lucky that we have lovely people like Chelsea that are willing to give up their time and come and talk to you guys. So if you could all say thank you, that'd be great. I'm going to stop the recording and it will be available in the member zone. So if you've got anybody that you think will benefit from listening to it, please do direct them to the member zone. Any questions?